The Adult Congenital Heart Program at Stanford has been here for over 20 years. It's a collaboration between Lucile Packard Children's Hospital and Stanford Healthcare. It really combines the expertise of pediatric cardiology and pediatric cardiac surgery, who perform over 1,000 operations a year in congenital heart patients across the network of Stanford Children's Health. And combine that with the adult hospital at Stanford Healthcare, highlighting the superior patient outcomes and reputation in adult medicine. And it's just so important to have the collaboration of both the pediatric and adult providers in order to ensure the best quality of care for our patients with congenital heart disease. We are one of the top 10 cardiac surgical programs in adults with congenital heart disease, and our 30-day mortality is less than 1%. We take care of some of the most complex patients with congenital heart disease and offer the best outcomes to patients and their families. The reason why people come all around the world to Stanford is because of our expertise in not just cardiac surgery, but also transplantation. There's a lot of history here because of Norman Shumway. Everybody remembers Norman Shumway as the surgeon who did the first heart transplant here at Stanford, but he also did congenital heart surgery. And so we have a long legacy of taking care of congenital heart patients here at Stanford. That legacy continues now with our group of ACHD cardiologists, one of the largest board-certified ACHD cardiologists in the United States. We have over 10 board-certified cardiologists in adult congenital heart disease. Stanford is synonymous with innovation. Being here at Silicon Valley, we are constantly collaborating across the university setting with our engineers and scientists and participating in the latest clinical trials. And that benefits our patients so that they are at the forefront of research and innovation. We were one of the first ACHA, ACHD accredited comprehensive care centers in the United States. At Stanford, we treat over 2,500 patients with congenital heart disease, and it takes a multidisciplinary team to care for these individuals, including our pediatric cardiac surgeons, as well as an adult provider to manage their comorbidities. These individuals have unique features, and every one of their anatomies are different. And it's not just the ACHD cardiologists that are part of your team, it's the cardiac surgeons, the electrophysiologists, the transcatheter interventionalists, the social worker, the advanced practice providers, the nurses, the psychologists. It really takes a village to care for these individuals. And the goal of the group is to improve the quality of life. So it's of utmost importance that patients have a touch point with an ACHD center. The ACC AHA guidelines actually recommend that individuals with congenital heart disease should be seen in an ACHD center in collaboration with an ACHD cardiologist. We receive referrals from mostly around the Bay Area here at Stanford for adults with congenital heart disease. However, our reach is beyond the Bay Area for a lot of our complex congenital heart patients. It's really important to provide lifelong care for individuals with congenital heart disease, and here at the Adult Congenital Heart Program at Stanford, we're really proud to collaborate with all our referring physicians in order to provide the best outcome for our patients with congenital heart disease.